Hello, I'm Paul Check, and welcome back to the Diamond Mind, Growing Wealth Through Knowledge. Today I want to share GEM 4, which is about core intelligence. Now, I've been in the field of orthopedic rehabilitation and holistic health for 27 years now, and I was doing core assessments to identify inter-unit disorders and spinal instability problems and all sorts of things long before the whole inter-unit and outer-unit craze ever began. So I've worked with thousands and thousands of people with serious spine pathologies. I used to own a physical therapy clinic. I worked in physical therapy clinics and chiropractic clinics for years. I was the trainer of one of the best boxing teams in the world. I've worked with numerous professional sports teams and too many professional athletes to remember. And over the years, one of the things that became very, very apparent to me some time ago was that even though you could isolate a person's inner unit using things like blood pressure cuff technologies and other methods for accessing the inner unit or the transverse abdominis pelvic floor multifidus diaphragm interactive unit, no matter how good they were at any one given exercise, such as the blood pressure cuff or abdominal hollowing, it was no guarantee that they would maintain that function while doing other exercises. So that was a very, very important realization for me many years ago in my clinical practice, which I never would have actually figured out if I did not have a significant amount of skill in the field of weightlifting and athletic conditioning. What I noticed by observing my patients, particularly those that were injured or that had spinal instabilities and pain, is that some of them could pass inter-unit tests, yet then when I tested their movement patterns, they did not demonstrate functional core stability. I found, for example, that some of them would have functional core stability with a bending over and pulling exercise, yet when they did a pushing exercise, they had no core control and often experienced pain. So over time, what I found out is that there are 7 primary movement patterns that the body uses as what Richard Schmidt calls generalized motor programs. These motor programs, the squat pattern, the lunge pattern, the bend, the pull, the push, the twist, and gait, which is walking, jogging, and sprinting, all have individual motor control strategies. The brain actually has to develop an integrative strategy for inter-unit or stabilizer muscles with prime mover muscles for each specific movement pattern. A generalized motor program is called a generalized motor program because it is involved in many other movements. For example, when you train to do the squat properly in the gym, you are simultaneously learning how to do any movement that relates to the squat, such as getting on and off of a toilet, up and down out of a chair, jumping, shooting a basketball. Any kind of squat movement is linked neurologically to your basic awareness or capacity to do that squat movement. The same with the lunge, the bend, the push, the pull, the twist, and gait. So if someone is seeing you for help and you do activate the inner unit with isolation exercises, they may look like they're back to normal again, but the reality of it is that you have to test their ability to functionally stabilize using these 7 primal movement patterns, which I show you how to do in my advanced training programs, and I teach you all sorts of techniques for identifying isolation problems and reintegrating, and how to do that effectively, how to use the right stretches, joint mobilizations. In scientific back training, I show you how to help people with sensory motor amnesia, which means they've forgotten how to recruit key muscles in their body because they've often been in pain so long, the nervous system forgets how to do it. So these are just little key tips. So the take-home gem today is that even though somebody can isolate the inner unit with specific isolation exercises, is no guarantee whatsoever that they have functionally integrated strength. We can only determine when they're functionally integrated by testing my 7 key movement patterns: squatting, lunging, bending, pushing, pulling, twisting, and gait. So if you want to learn more and gain more wealth so that you can gain more financial stability than the knowledge available to you in Scientific Core Conditioning Correspondence Course, Scientific Back Training Correspondence Course. My book, Movement That Matters, is going to really help you increase your earning potential and help more people get pain-free and improve their athletic performance. My little book, Movement That Matters, goes into the neurophysiology of movement and gives you the basics of how the motor system works. It's an easy read and highly important. Feel free to visit CheckInstitute.com to order any of these products. Visit CheckConnect.com, our social networking site, where there's all sorts of free information just like this, and there's some subscription information and product information, products that can be gained there as well. So thanks for joining me for our Diamond Mind Gem today, integrating the core through functional movement. I look forward to sharing with you in future Diamond Mind Gems. Thanks for joining me. I'm Paul Chek. Enjoy your successes in the gym with my very effective correspondence courses, reading materials, audios, and videos. Look forward to sharing with you at an upcoming workshop. Bye-bye.